You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
And welcome back to the program. Joining me now, Senator Fred Love, Democrat of Mabelvale, Representative Mary Bentley, Republican of Perryville. Thank you both for being here.
Good morning. Thank you for having us.
All right, before we get into some politics, I got a little pop culture pop quiz for you both, okay?
Hit Fred first.
All right, Fred. Which is the better song for your walk-up song? Is it Love is in the Air by Barry White, or is it Dr. Love by Kiss?
Love is in the Air by Barry White.
That is the correct answer. Mary, for you, is it Along Comes Mary by the Association, or is it Proud Mary? The Tina Turner version, not the CCR version.
I've had the Proud Mary sang to me before, so let's go with the first one.
Okay. All right. All right, you, the three of us were joined on a Rural Health Association panel this past week. We had a really good conversation, I think, about some things that happened in the legislative session related to health care. Mary, I'll let you start first. What do you think was one or two of the more consequential pieces of legislation that passed to help health care in Arkansas this last session?
I think I'd like we talked about then, the simple bill that I passed with Justin Boyd is to help my constituents who live in rural Arkansas to be able to get a prescription filled at the hospital before they leave was a really important thing, I think, to get passed, just to help. To me, simple things sometimes go a long way to make sure we're getting patients the care they need and not missing out on the follow-up treatment that they need. So I think that was an important piece of a thing that we got passed there. And a lot of things got passed in insurance, right? So we really were pretty quiet in public health care, but I want to bring up some things that happen in insurance with pre-authorization things that are really important. I think a key bill that we passed by Representative Johnson, our new chairman, who I think did a great job being our chairman this session, to make sure that primary care physicians out there get that pre-authorization early so patients can get the care while they're there. And it was really, to me, some red tape we need to get rid of. I think it was a good program that we passed in insurance.
Yeah. Fred, how about you?
Well, I've been impacted by prior authorizations as well, so I thought that was consequential. I think a couple of things that we did, and I know Aaron Pilkington was there yesterday, and he talked about things that we did about maternal health. But one piece that I worked on previously and that passed this session was the PrEP and the PEP bill for HIV medication and allowing for pharmacists to dispense that medication. And I think that is very important because, you know, if you can get that medication into your system early enough, then we could fight the disease better.
It's life-saving, yeah.
Yes, it's a life-saving. So I think that's important. I guess we can talk about the tire bill.
I would like for you to talk about that. I thought that was a really interesting perspective. I hadn't thought about that.
Well, you know, as the Director of Community Services for Pulaski County, I'm a county guy. And so I think about things like that because the tire bill, you know, we have a lot of waste tires being dumped around the state, and we've been working on tire issues for.
And what did the law change in that? It basically set up a new program for collecting and disposing of those tires.
So it set up 4 districts, number one, and then it put in place where those 4 districts could collect the waste tires. Previously, we had several other districts that was collecting, and the funding system was just not there. And what we tried to do is we tried to actually put a funding mechanism in there so that it can actually sustain the system.
And the public health angle is?
The public health angle, for me, I talked about the vectors. I mean, we don't think about the vector-borne illnesses that mosquitoes and different insects like that carry, and so therefore we need to make sure that we could take care of that the waste tire issue.
So we were with a group of rural health advocates when we did our panel discussion there. Lots of concerns about what happens for rural hospitals. They're already struggling financially right now. When some of this disenrollment happens with Medicaid, they're not going to turn patients away even though they might be uninsured. There's an expectation that uncompensated care is going to rise. As legislators, how do you know this is a problem that's coming, how do you start preparing for that?
Well, I think every public health committee meeting started with that conversation, really. We talked about it, and even with my colleague Deborah Ferguson, who was there. So we are making sure that our providers right now are getting the word out as much as possible. So this is going to happen, this is on the horizon. Be prepared, get ready for that. So I think we're trying to do the best that we can. I think DHS is more prepared than they were in the past. I think that their mechanisms there in place and their computer system is much better than it was. So I think we can do it a little bit quicker on that. So I think we're really...
There is a story that some some Medicaid recipients have been kicked off of the system accidentally. Just came out in the last 24 hours. I'm sure that's something that's going to get corrected. But
sure. Well, and again, I think Fred will tell you that we have a great communication system with DHS. We have Lord McDonald and folks that have been there for a while, know what they're doing, and we are there to help our constituents. We do that all the time. That's what our job is. I get phone calls all the time to make sure that so those folks that fall through the cracks, they can call the state legislator and get some help, and that's what we're here for.
And that's
right?
what I was going to say. You know, as a legislator, I want to be there for my constituents, and so I always tell my constituents, give me a call if you have any issues with DHS, but with any other state agencies. Please give us a call. I was just visiting with the secretary, and April 30th that's kind of like the deadline. And so people really need to return their paperwork, their re-enrollment paperwork, make sure that they qualify. And so we just really need to get the word out, Roby, on re-enrollment.
Yeah. So basically what is happening is out of COVID-19, the pandemic, it was an automatic enrollment for people into the Medicaid system if they did not have insurance and they found themselves accessing health care somehow, some way. This is cleaning up those roles now that the pandemic is over. And that's why we're disenrolling people.
And we're hoping some people have gotten to work, right? So hoping some people have got a job so they don't need it anymore. And we need to make some flexibility in between times. So that's why I think I was glad that one Farm Bureau bill passed. So maybe there's some steps where people can go to get some interim insurance to cover. So that's what we're there for.
Now that the emergency is over, we are going to have to clean that up. But here's the thing, and Mary talked about, the able-bodied people being able to work and people going back to work, and that's great. But there is going to have to be some bridge there for those that do fall through the cracks.
There's also some potential stress that could be on the state finances as a result of disenrolling people. Right now, I think it's a 90-10 split in terms of the feds pay for it versus the state paying for it. That can change when you start putting people into another place in the Medicaid system. How worried are both of you about what this could do to finances, or do you think that there's enough set-aside money to kind of work your way through this process?
I think we're looking pretty healthy, don't you, Fred, as far as finances go now on that?
Our Medicaid trust fund should be fine. We may need some additional funds, but I think our surplus will be able to handle that. But yes, we definitely need to look at the issue to ensure that Arkansans stay insured.
You guys spent a lot of that surplus in this last session. I tallied about $1.5 billion in additional spending from just one-time money there. So y'all, I mean, I
think we did some good investments, but again, we've been frugal along the way. I think we've been a state that's really, again, we have general revenue, so we keep on top of it, unlike other states that don't do that. So I think we're looking good. And again, we're here with ALC, right? We can look at things as we go along. We can make sure things it's not going to, like we're just going to avoid it. We're going to pay attention as it goes along and be there to do what we need to do.
Last week, I had Governor Sarah Sanders on the program. She talked, she said it's not a 100%, but there is certainly conversations going on about having a special session on Medicaid later this year before the fiscal session. I think disenrollment's one of those things. Is there something we need to tweak in terms of policy or financing? You've got her work requirement waiver that is still working its way through the process. Are there other things that you think, that you hope are on a call for a special session dealing specifically with Medicaid?
Well, I think specifically with healthcare, I talked to you about, I think we might need to do something with nursing to make sure our nursing schools have what they do to make sure we have good instructors to move forward, because it's kind of a crisis. To me, it all is going to impact us financially if we don't keep our nursing staff up, right? So we were at a crisis point before the pandemic, now it's even much worse. So that might need to be part of it. But again, I think we were so focused on the LEARNs and on crime this past session that we may need to take some special time. Medicaid's a big part of our budget, so it deserves some special attention. So some things that we need to address, I think we're there to take a look at it.
I surely do think that Medicaid is a large part of our budget, and when we disenroll people, I mean, that's going to impact our hospitals, especially our rural hospitals, and so special care needs to be. And so I was talking to them about the ALC subcommittee on hospitals and Medicaid. I think we really need to use that mechanism to address the issues that our rural hospitals are going to face. Because as you know, before, when we adopted the private option, that was one of the reasons why we adopted the private option, because we had so much uncompensated care, charity care, and so we can't have.
We saw that number come down significantly as a result. Yeah.
So we really need to address that, but to ensure that Arkansans are getting the Medicare care that they need.
going to be fun to watch you guys battle it out over Medicaid again. It's only been like a decade-long battle that we've been watching all of this, so we'll see what comes of all of that.
I think we need, again, I just want to make sure we want to make sure Medicaid's there for those that really need it, those people that are disabled and that can't work. And I want to make sure that that program survives, to make sure those people that really need to have it and those that we can help get a good job and move forward can do as well. So I think we'll all work together.
Do you think
on
there's
that.
any chance of Medicaid expansion, getting the plug pulled on it at this point?
At this point in time, I can't say that I'm not concerned about that, but I would say that it would be detrimental to our state budget to do that.
What do you think, Mary?
I think we might need to, I'm not opposed to looking at how, I think the expansion's there, but how we do it. Maybe we can tweak that a little bit. I'm not opposed to looking at things how we can tweak it and do a better job of it. I've been one concerned about the rates that we've gone to our primary care physicians. I don't think we're not doing enough on Medicaid. So I want to take care of those kids and those disabled folks that really need it, have it there to make sure they're getting care. Because right now they're months getting a specialty visit and all that. So again, I'm not opposed to looking at it and to make sure we do a better job of it, because we tweak things all the time. Every time we come back to session, we're tweaking things we've done. So I'm not opposed to tweaking it, make sure we do a better job for Arkansans.
All right. Along comes Representative Mary Bentley, but Senator Fred Love is in the air. So thank y'all both for being here.
Thank you again for the time. We appreciate it.
So, we're back with more after this.